Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. You know, while antibiotics are life-saving drugs, they aren't without some risk. The most common cause of emergency department visits for adverse drug events is in the case of antibiotics. And every year, about 2 million people or so become infected with bacteria that are resistant to antibiotics. Our guest in studio is Dr. Aaron E. Glatt, spokesperson for the Infectious Disease Society of America and also chair of the Department of Medicine at South Nassau Communities Hospital. And he's here today to speak with us about efforts to improve the use of antibiotics. How are you this afternoon, Doctor?
I'm fine, thank you. Thank you for having me and for discussing this very important question.
Thank you for joining us. Now, I understand that there's an effort to raise awareness in that there's an Antibiotic Awareness Week in an effort to raise awareness about the beneficial use of antibiotics. Now, I understand that it's an awareness effort that is ongoing. Talk about some of the problems associated with these life-saving drugs.
Sure. So antibiotics are a godsend. They really are life-saving and have had tremendous benefits for many people with serious infections. However, antibiotics are a two-edged sword, and that's why the Centers for Disease Control and Prevention has declared an Antibiotic Awareness Week, and it's not just 1 week, so if you missed it, you're okay, because it's a continuous 52-week-a-year type of an effort that's incumbent upon physicians as well as all other healthcare practitioners, as well as patients to understand how and why we want to use antibiotics properly and to save this tremendous tool in our medical armamentarium so we can continue to save patients' lives and not, heaven forbid, be in a situation where we're in a post-antibiotic era where we don't have the ability to treat infections. Antibiotics are very valuable tools to treat certain infections, specifically serious bacterial infections to the most part. Unfortunately, antibiotics aren't perfect, and antibiotics can have tremendous amounts of side effects associated with them from the drug itself, but they can also have impact on society by changing the resistance patterns. When you get exposed to an antibiotic, the bacteria in your body and the bacteria that have been exposed to that antibiotic are potentially impacted in a positive or negative way. If you eradicate the infection, that's wonderful. But if you unfortunately cause resistance to develop, so then what you've done is actually made things worse in some ways, in that if the patient then gets infected or transfers that antibiotic-resistant bacteria to another patient, when they get sick, they can be much more seriously impacted, and you may not have an antibiotic left to treat them with. This is the development of antibiotic resistance that's been increasing and worsening over the years. In addition, you now have inability to treat some of these infections as an outpatient. You can't give them oral antibiotics anymore, and instead you have to bring them into the hospital and give them intravenous antibiotics, or even if you can give the intravenous antibiotics outside the hospital, you've upped the ante. You've made it that much more difficult to treat these infections. And the cost is not insignificant.
Now, Doctor, I'm going to ask, in your opinion and in your experience, which factor is the most, the heaviest contributing factor to this resistance to antibiotics? Is it the patient's physiology based on taking antibiotics over the years and their physiology becoming more resistant to what the antibiotics can do? Is it the infection itself, or is there something going on in the pharmaceutical industry that has to do with this ineffective antibiotic treatment?
So when Fleming discovered penicillin and in 1945 accepted the Nobel Prize for this, he mentioned already then that antibiotics are not perfect, and antibiotics can have resistance developed to them. And it's a multifactorial. There are many, many reasons why bacteria become resistant. But the major problem, I would say, to answer your question, the major problem right now is inappropriate antibiotic usage. When a person has a cold and they come to their doctor and the doctor prescribes them an antibiotic for various reasons, when it will have zero benefit and only potential toxicity. And unfortunately, a very significant percentage of patients who are prescribed antibiotics are being prescribed them inappropriately. Antibiotics do nothing for the cold. Antibiotics do nothing for most cases of upper respiratory infection and bronchitis and sinusitis. These are very frequently prescribed reasons for antibiotics. Antibiotics are very, very important treating true urinary tract infection, but many, many patients are given antibiotics who don't have urinary tract infection. Patients demand antibiotics or else they'll go to a different doctor. Patients think mistakenly that taking antibiotics that they have from a previous visit that they still have in their medicine chest are still good and are appropriate for the next time they have any sort of a problem. So the major issue that we have today in terms of antibiotic usage in the United States is inappropriate antibiotic usage. If you eliminated that, you would solve a tremendous amount of the problems that we have with antibiotics.
Now, talking about eliminating the improper use and, I guess, improper prescribing of antibiotics, we kind of look to our healthcare providers to tell us what to do, and none of us are doctors. Why do you think that it is that a physician would go ahead and prescribe antibiotics based on the desire of a patient who's not a doctor and has no training in how antibiotics work and how they affect the body based on what infection you have?
So that's a very good question, and I wish I had a very good answer for you. A lot of it is education. Physicians need to be re-educated as to the importance of properly prescribing antibiotics. And patients do sometimes put a hard sell on a physician saying, no, I know I need an antibiotic. Last time I had an antibiotic, the other doctor gave me an antibiotic and it worked. And physicians are sometimes, unfortunately, giving into that peer pressure, and in part is because they're not themselves convinced that the patient is wrong. The bottom line is, certain infections, there's tremendously hard, strong evidence that those infections will not be benefited by an antibiotic. And in fact, an antibiotic will make the patient worse, not better. It's an educational message that we have to get across better to physicians.
Now, speaking of education, both for the physicians and the patients, is there in existence, I guess, a list that corresponds and says, okay, this condition calls for this antibiotic, this condition calls for that antibiotic, and so on, so that there's a cut and dried guide when someone comes in who's probably been brainwashed by the commercials that we're given, that none of us can buy these products. We can only go to our physicians, yet they advertise them to us.
Right. So it's not as cut and dried as you said, but to a certain extent there are recommendations and guidelines put out by the Infectious Disease Society of America, as well as other very important and impressive societies that do recommend for certain indications, certain prescriptions be prescribed. However, much more importantly is the indications where it's not indicated. The patient who has a cold, has a viral illness, that's probably the number one reason why antibiotics are prescribed, and it does absolutely nothing to shorten the duration of therapy or to prevent them. Many times, patients and physicians alike think that by giving this, I'll prevent a more serious problem. What they're in fact doing is not preventing anything from occurring, but they are guaranteeing that if an infection does occur, there's an excellent chance they'll be resistant to the antibiotic that was prescribed. Plus, there's the toxicity. And plus, there's a very insidious disease out there called C. difficile, which is actually an infection that you get because you took antibiotics. And the antibiotics actually spur or allow that infection to occur, and we're seeing more and more of this infection, and we're seeing more and more serious complications from this C. difficile. So one of the major reasons not to give these inappropriate antibiotics is that they actually can cause or stimulate your body to get this infection.
What steps, other than the obvious as far as Antibiotic Awareness Week and other efforts, what steps is the CDC and other organizations taking in order to get this information to our potential physicians, those that are entering medical school, those that are in their residency? What's being done to get this information out there so that we don't have this misuse of antibiotics that are so beneficial when properly used?
Sure, that's a great question. And the government has actually mandated as of January of 2017 that every single hospital have a fully functioning antimicrobial stewardship program, which essentially states that every hospital has to figure out a plan how to appropriately use antibiotics in their hospital. So, for example, at our hospital, South Nassau Communities Hospital, we have a very robust and a very strong program in place now for many years, and we've been constantly increasing its vigilance and its surveillance and its oversight to guide and educate physicians in the proper usage of antibiotics, and we've been extremely successful. And as a result, we've seen tremendous decreases in some of the complications here at South Nassau of some of these infections like C. difficile. And that is what every hospital needs to do, to put together a robust educational as well as guidance program in place for young physicians as well as for more experienced physicians to remind them this is appropriate, this is not appropriate, and also stopping the antibiotics when it's no longer appropriate. It may have been appropriate day 1, but when you have more information on day 3 or day 5 or day 7, that initial correct antibiotic may no longer be necessary. So appropriate durations of therapy, appropriate routes of therapy, appropriate what we call de-escalation of therapy, downgrading from a broader agent to a more specific agent. This and many other tactics are essential in making sure that we use antibiotics appropriately. And at South Nassau, for example, we're way ahead of the curve.
Now, where can our listeners go and get more information about how antibiotics should be used?
So they can go to our website, certainly, and we have a number of videos that are geared for patients to understand how antibiotics are properly used, and that's the South Nassau Community Hospital's website. They can certainly go to the Centers for Disease Control and Prevention website, the CDC's website, as well as the Department of Health website for whatever state they may be in.
Well, it's been a pleasure talking with you this morning. Thank you so much for coming in.
Oh, it's absolutely my pleasure, and thank you for raising this very important subject.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Glatt. And we've been talking about the proper use and the improper use of antibiotics. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.